now one of only 28 Florida hospitals to be designated a Level 2 trauma center. Tonight, News 13's Jessica Foster tells us how this specialized care is helping severely injured patients survive. As tonight's Modern Medicine reports.
Survival rates increase significantly when severely injured patients are taken to a trauma center. Doctors say trauma injuries range from workplace accidents to gunshot wounds, but most of them are car and motorcycle accidents.
From what I understand, my whole head was basically swollen. I landed face first in the dirt, and my fiance was on his back.
A motorcycle accident led to Julie Drew being rushed to Bay Medical Center.
It all started from the ambulance. Once the ambulance picked us up, they started working on us. They basically saved our lives, and then they brought us here, and it went straight from there.
The care begins in the field with the paramedics. It continues from the time they get in the door, and our goal is to really have that patient adequately resuscitated and worked up, at least in terms of determining what their injuries are, within an hour.
The trauma center utilizes specialized equipment and a team of experts that can immediately move into action.
With this designation and the things we've done to achieve it, we have a team in place, a level of training in place, resources in place, both in the physical plant and from personnel standpoint, that can take care of injured patients like they've never been taken care of before in Northwest Florida.
Julie is now back at work and has recovered well. She's optimistic that her fiancé will soon be completely healed.
You just take everything for granted. And I've always heard people say that. Now I understand. Totally.
The Trauma Center Medical Director, Dr. Glenn Summers, says Bay Medical also wants to act as a center for prevention, educating the community on how to avoid injuries and stay safe.